For the concept of infection, our exemplar is CDiff. CDiff infections occur when the balance of normal bacteria of the gut is disrupted, which is often caused by antibiotic use. Antibiotics can kill off healthy bacteria, allowing C. diff to overgrow and produce toxins. These toxins damage the intestinal lining by causing inflammation, cell death, and disruption of the gut barrier. This can lead to symptoms such as watery diarrhea, abdominal pain, and fever. C. diff can be dangerous in vulnerable populations such as those with a weakened immune system or the elderly. More specifically, those populations at risk are patients on antibiotics. Antibiotics can disrupt the normal gut bacteria, allowing C. diff to overgrow, and the use of broad-spectrum antibiotics increases the risk. Another population is older adults, those over 65 years of age. Older adults are more vulnerable to C. diff infection due to age-related changes in the immune system and a higher likelihood of taking antibiotics. Another vulnerable population is hospitalized patients. Hospitals and long-term care facilities are common settings for C. diff spread due to the use of antibiotics, close contact, and potential exposure to the bacteria through contaminated surfaces. The next one is immunocompromised patients. These are individuals with weakened immune systems, and they are at higher risk due to their body's reduced ability to fight off those infections. The next one is patients with previous C. diff infections. Individuals who have had prior C. diff infection have an increased risk of reinfection. And the last population is patients with chronic health conditions, as these individuals with chronic conditions such as inflammatory bowel disease or gastrointestinal disorders are more susceptible to developing C. diff infections.
Good morning, Mrs. Adams. I'm Marissa, I'll be your nurse today.
Good morning.
How are you feeling?
Honestly, not too great. I've been having this awful diarrhea for the past 3 days.
Oh, I'm sorry to hear that. I hope that we can figure out what's going on and get you more comfortable. I just need to confirm a few details first. I'm just going to look at your wristband. Can you tell me your name and date of birth?
Linda Adams, October 19th, 1957.
Okay. And I understand you were hospitalized for a hip injury. Were you on any medications after that?
Yeah, they gave me antibiotics for a while in the hospital, then I had some to take home. I've also been using ibuprofen for the pain.
Okay. So let's talk about your symptoms. So you mentioned diarrhea. How often has it been happening?
Honestly, like 6 to 7 times a day, and it smells really bad.
Okay. Are you having any other symptoms, like a fever or stomach pain?
My stomach's been hurting a lot.
Okay. So we'll go ahead and do a quick assessment. Real quick, I'm just going to do a real quick health history. Can you tell me about your health history?
Well, yeah, I have type 2 diabetes. I also have high blood pressure. For the diabetes, I'm taking metformin, and for the high blood pressure, I'm taking lisinopril.
Okay. And then I see you were also recently hospitalized for a hip replacement. Do you have any history of gastrointestinal disease?
Nope.
Okay. Do you smoke?
I don't smoke.
And do you drink?
Sometimes I'll drink a little bit of wine.
Okay. And what about at home? Are you independent? Do you have some assistance?
No, I'm completely independent.
Okay, sounds good. I'm going to take your vitals real quick.
Okay.
I'm going to take your temperature. It's 100.2, so you do have a little bit of a fever. I'm also going to get your blood pressure. It's 128/78. I'm going to count your heart rate. It's 98 beats per minute. Respirations are 18, and your oxygen saturation is 98% on your neck. So I'm going to start with physical assessment. It's going to be focused on your abdomen. So can I have you lay down?
Yep.
So just walking in the room and looking at her, I can see that she appears a little bit flushed and fatigued, as she had mentioned. Real quick, can I have you open your mouth? Okay. Her mucous membranes appear to be dry. I'm just going to take it with your arm. Okay, pinch your hand. Skin sugar is reduced, which can be an indication of dehydration. Have you been able to drink much?
No, I don't have much of an appetite, and it makes me nauseous.
Okay. So I'm just going to look at your abdomen. and I'm just going to palpate a little bit. So her abdomen is soft and it is slightly distended. And before that, I took a listen to your bowel sounds. They are hyperactive and present in all quadrants. Like I said, I palpated it, and does it feel tender when I palpate?
A little bit.
Okay, so there's some tenderness in the lower abdomen, but she's not guarding. And then as far as percussion, there's tympanic sounds, which means possible gas accumulation. So your abdomen is a bit tender, and I can hear a lot of activity in your bowels, which is expected given your symptoms. We also ordered a stool sample to test for CDiff, which is a common infection after antibiotics. And while we wait for the results, we'll begin treatment to keep you stable and comfortable.
Okay, great.
Okay. And we're all done with that assessment, so go ahead and sit up. And then the next thing we'll go over, we'll talk about some education points and then our final care. Labs, and I'd like to go over a few important things about your treatment and your expected outcomes and what to do once you go home. Does that sound okay?
Yep.
Okay. So the first intervention is going to be medication. So you've been started on oral vancomycin, which will help to kill the C. diff bacteria. And that's why you already had less bowel movements over the time you've been here, and your fever has gone down as well. The second intervention is IV fluids, and this will help to treat the dehydration. Your mouth isn't as dry as it was before, and your dizziness when standing has also improved.
Cool, yeah, I feel steadier standing up.
Good. The third intervention, we have placed you on contact isolation precautions. And that just means that since C. diff is contagious, we've kept you in contact isolation, which is why I'm wearing the gown and gloves. We've also gone over hand washing with soap and water, and that hand sanitizer won't work with C. diff.
Yep, I wash my hands a lot. I'll keep doing that.
Awesome. And then the fourth intervention, we've been monitoring your stool output and lab work daily. Your white blood cell count has gone down and potassium levels are back in range, which means your body is recovering well. And then next we'll go over some discharge instructions. All right, and then before we send you home, we're going to go over some important steps before discharge. So it's really important that you finish all 10 days of the vancomycin, of your antibiotic, even if you start to feel better. It's also important that you don't use any anti-diarrhea medications unless your doctor says it's okay to do so. It's really important to have clean surfaces at home, especially in the bathroom, with bleach-based cleaners. It's important to keep drinking fluids and eating small meals, and you could slowly return to your regular diet. And if the diarrhea or cramping comes back, then you can call your provider right away.
Okay, sounds good. I really don't want this to come back.
Yeah. And while you've been here, you've also had support from several other specialists who were key to your care. So there was the infectious disease doctor who helped choose the right antibiotic and will follow up if your symptoms do come back. Our dietitian worked on a GI-friendly meal plan that helps to support your gut and helps manage your diabetes. And then also the physical therapist helped get you moving safely after your surgery and during recovery. That reduces your fall risk and maintains your strength.
Alright, I feel like I've learned a lot, and I'm already starting to feel better.
Awesome. You've done great, Mrs. Adams. Let's keep that progress going at home. You're almost ready for discharge. We'll walk through your paperwork together shortly.
Sounds good.